All right.
Okay, sorry for some minor technical issues. I'm here, I'm live, I'm ready, I'm excited.
Okay, let's quickly begin because we're under a little bit of a time crunch. We have with us two distinguished guests. So let me give a quick background of where we are in the process and introduce the show today. So today we are going to talk about one incredibly important facet of what's been going on and in terms of careers and opportunities, education, and so forth. And that's the field of healthcare. It's a very, very important field, one that has been a mainstay of right track admissions for quite a number of years. And we still advise, we work with people who are doctors, nurses, dentists, pharmacists, have so in the past, and continue advising them in the future. But medicine has taken on a little bit of a different approach in the last I'd say 5 to 10 years, which has really been a huge push for advances in medicine in terms of accessibility to general public, in terms of technology that is immediately available to people. And we're seeing the necessity of that with what's going on, especially in the COVID crisis. So what we have with us today is two different perspectives, two different career paths, both pursuing healthcare in different ways. And I want to introduce our guests to you today so they can quickly introduce themselves, and then we can jump right into the show. So without further ado, let's have quick introductions. Wafaa, you're still on mute. There you go. Perfect.
Okay, I'm back on. I'm Wafaa Alrashid. I'm a primary care doctor and an internist in Pasadena, California. I'm also core faculty at Huntington Memorial Hospital and also faculty at Keck, USC.
Fantastic.
Wow. Okay, so at least one of the two speakers is extremely credible and legitimate. The other one is me. Hi, everyone. My name is Khalid Kutaili, living in Boston. Very quick background. So I actually met Hamada at the Harvard Kennedy School, and we've been in touch ever since. I actually started my own company after graduating. So I run a male fertility company called Legacy. We offer at-home, from-home services for any man who's thinking about becoming a father in the future, which is most men. And we've been operational for about 2 years. We've raised a significant amount of investor funding. We went through Y-Combinator. We were incubated out of Harvard. So lots of exciting stuff to share, particularly during COVID, which hopefully will be relevant for anyone listening in.
Fantastic. Thank you so much. As you guys can see, we are approaching it from two completely different perspectives. Wafaa will talk a lot more about her run at it from a medical school, more the traditional path and kind of where she is now, and then how she's incorporating technology and thinking about future proofing for herself and for her patients. Khalid's looking at it from a more entrepreneurial perspective, having gone from healthcare consulting through to where he is now as an entrepreneur in this space. So let's kind of shift focus and do a quick overview. And again, as you guys know, Right Track Admissions, an admissions consulting business, has been doing this area of admissions consulting for almost 12 years now. And myself personally, in terms of quick background to who I am a lawyer by training. I've done international development law, local commercial contracting law, as well as doing admissions consulting and entrepreneurship. So I came at it from a completely different angle. I'm not a specialist in the healthcare field, but it is one that's fascinating and one obviously that my life depends on it. So without further ado, let's jump right into it. I know, and I want to say from the beginning that Wafaa is going to have to jump off. Dr. Wafaa is going to jump off because she has patients, COVID related and otherwise. So we only have her for a very small period of time off of the show. But so a little bit of the front focus of the show will be with Wafaa. And then the back end will be more with Mr. Khalid. So let's jump on. If you can, already the phones are blowing up, huh? No worries at all. Okay, so Wafaa, tell us a little bit about your background and kind of the path of how you got to medical school.
Okay, so I knew that I wanted to be a doctor from a very young age. That was my goal. I graduated from Utah State University and I applied nationally because it's very hard to get into medical school even now. And I got accepted to Howard University College of Medicine in Washington, D.C., completed my MD there and applied for residency in internal medicine. I wanted to be in a primary care provider. So I came out here to Huntington Hospital in Pasadena, is where I matched. And those of you that are applying to medical school, you will know that there's a process called the match, which basically you don't really know where you're going to go until you match. I have been here ever since I completed my residency in 2007, and I became one of their core faculty here. So I became a hospitalist for 8 years, and then I realized that my passion was more in primary care, and I opened up my own practice, which, speaking of entrepreneurship, there's actually a lot of that in medicine, which they don't teach you in medical school. So now what I do is I have my own practice. I go to the hospital and see patients there as well, and I teach the medical residents and the medical students at USC. And that, in summary, is what I do.
That is a great summary. And I'm going to dive a lot more deeper into that, but let's quickly, Khaled, maybe you can tell us a little bit about your background in terms of going, in terms of undergraduate until getting to the Kennedy School and kind of what you did in between.
Sure. So unfortunately, if you're a good Arab son or daughter, then you should be a doctor, a lawyer, or an engineer. So obviously, Wafaa crushing it on that front. I was frankly never smart enough to be any of the three, but I had grown up in Lebanon, and if you're Lebanese, then being in business is kind of okay. So I went to McGill, I studied business, and I ended up joining a management consulting firm after graduation called Oliver Wyman. So I worked out of Toronto for a few years, specialized in healthcare. And that's actually a lot of what kind of got me interested in healthcare. It just felt like, for any of you familiar with the world of consulting, you are doing very high efficiency, very high productivity work that is probably net negative for the world. But it felt like, at least in the world of healthcare, you were generally working with hospitals, insurance companies, companies that were actually making a positive difference. So ended up spending a few years there. I then made a bit of a jump. I worked with UN Women for about 6 months in the Middle East as a volunteer opportunity, and kind of through that springboarded to joining the Harvard Kennedy School. I've always felt that to succeed in life, you need to have a mix of perspectives. And I think having a bit of business, a bit of policy, a bit of entrepreneurship, and a bit of a not quite a medical background, but a healthcare perspective would be something that was valuable. And it has always been Hamada who has been extremely insightful on thinking through how to frame my career and my path when I was applying for jobs after the Kennedy School. So I ended up joining the World Economic Forum, focused mostly on Middle East relations, working with a lot of governments and businesses in the region, until eventually deciding to branch out and start my own thing.
Fantastic. Thank you both. So obviously the common strain and thread in here is the entrepreneurial perspective, something that I also obviously was involved in. I mean, again, from my background, after graduating from law school, and working in a traditional law firm and then working with U.S. government. In between that, I started Right Track Admissions, which I always felt was a very important way of, I guess, future-proofing my own career and providing myself with a second path, and also a mechanism of introducing myself to a lot of incredible people, some of which I've come across like Khaled, through the admissions work in terms of going to the Kennedy School myself, understanding that perspective, meeting Khaled there, and so forth. But let's take it a step back to you, Wafaa. You talk about always loving the sciences. You did biology. I think you did a chemistry minor. Then you went straight to medical school, went and studied in Washington, D.C. And then you kind of branched into tell us a little bit more about that, because I know you said you went to, you came to Huntington Hospital, you started working out there, and then eventually you became a chief resident there as well, and then eventually from there becoming affiliated with a hospital, also in a teaching role, and so forth. What did you kind of learn from that perspective in terms of teaching and working with the students? How have you seen things develop, especially in terms of healthcare? And then I want to shift over to you taking that step away and also starting your own clinic, which actually coincidentally and very well thought out is located only several steps away from Huntington Hospital. Why do I know this? Because I've actually gone to your clinic. I love it. I think it's super cozy and comfortable. So tell us a little bit about that kind of transition and what you learned in that process.
So one of the things that never happens in learning the sciences is no one ever teaches you about the business side of things, the money side of things, the future of how are you going to build your own practice. No one ever talks about that. So as I went through, I loved teaching. I loved being in the hospital, but I wanted to figure out a future that I could grow in and live in. And for me, it was, I wanted to be my own boss, but no one had taught me any of this stuff. So I kind of dove into it. So, learning the sciences for medicine is very important, but you do need some other training. If I had to go back, I would go back and get my master's in business administration and do a course on coding and billing, because that's such a huge part of medicine. So now, as I teach the medical residents, what I'm seeing is there are things that they have to put in their notes in order to bill. So the hospital is very much involved in what they want the residents to learn, because guess what? It all comes back to reimbursement in addition to them learning. But in order for all of us to survive nowadays, we actually have to know hospitals, offices, every business that's involved in medicine. We have to know how to navigate that by knowing the business side of it. So now we're talking about including the business stuff and the billing and the coding in our teachings for the medical, not only the medical residents, but even medical students, which is kind of crazy. But for me, I mean, I'm very happy that I made that switch. I know, Hameda, you had another question in the bunch of the things that you mentioned.
Yeah, I mean, what I wanted to kind of find out from you was, in terms of if you could go back to school. Now, you mentioned an MBA, you mentioned business learning, which you feel maybe a knowledge gap amongst some physicians out there. You also mentioned, or one of the other areas that you kind of mentioned was, again, the billing, which is all technical and so forth. What kind of technical courses did you take, or you wish you could have taken that in medical school, or even outside of medical school while you're studying, that could have helped you in terms of where you are and kind of future-proofing your career?
Right now, there are really, truly not many options for somebody like me, or even for the residents. So really what it is just getting your hands in there and doing it, coding and writing in your notes. So believe it or not, this is something you might want to look into, but there isn't really anything set up for physicians, medical providers. And maybe Khaled has more experience, I don't know about this, but this part of it is not built in medicine. So it is something where an MBA would be of value, because you do need to know the administrative side of things. Now, if you want to be a CEO of a hospital or a CMO, you must go to business school. So it's becoming now a mandatory part of their training if you want to have an administrative role in medicine. But no, there is right now, I wouldn't know what course to take. You literally have to dive right in and learn. That's the challenge now with medicine, and it's transforming.
Well, let me ask you then, Khaled, I'll throw it to you. From the doctors that you have been working with, and we're going to get much more into the dream of legacy, where it started and so forth, when we have the opportunity and so forth in a little bit. But just from the doctors, because I know that that's a very important part, obviously, for establishing the credibility of legacy and so forth. But from the doctors you have, do you feel that they are tech savvy in a way that gets them up to where they need to be to really catch up with all the stuff that you're trying to innovate? And
on a scale of 1 to 10, negative 5,000. I think many, as Dr. Wafaa probably knows very well, the average doctor is not particularly tech savvy. And I think this is just a function of training. You're trained to heal, you're trained to diagnose, you're trained to treat your patients, you're trained to have good bedside manner, but technology does not necessarily come into play. And so you're so focused on staying up to date on the latest treatments that you're not necessarily up to date on the latest technologies. And part of it, frankly, is just you're dealing with so many large institutions that are extremely bureaucratic. They're living in the 1950s. And I know this from my time in healthcare consulting. We did a lot of work consulting with insurance companies that are still using systems. I mean, I remember using one program that was literally from the 1990s, right? And this was 2011, 2012, but, because for them, it worked. And I think the incentives, so I think there's a couple of big issues. If you're a doctor, the incentives are not there for you to be particularly tech savvy. There isn't a lot of technology that works across all platforms, across all hospitals. They all have extremely different backends. And so creating something that integrates across the United States, for example, is an absolute logistical nightmare. And so I think that's part of the...
Oh, Khaled froze.
Khaled froze. Well, then...
Want to add, Khaled's completely frozen. I just wanted to add, and I was hoping he could hear this part, that one of the things that's helped us is our electronic health records. Okay, so that's a huge part of medicine. But again,
the doctor's face.
Okay. There you are.
For a tech savvy guy, your computer is shutting down. let me note for the audience, Khaled's living in Cambridge. literally 2 steps away from Harvard. So I would have thought you guys would have some pretty powerful internet out there.
Nice.
How did you want to conclude that thought? You were just
Yes.
yeah.
I was just saying, I think, with Dr. Wafaa, opposite challenges, which is, for me, the challenge was really getting up to speed with all of the techniques in my has been working on the medical side. The challenge, how do you stay up to date with the latest and greatest technology?
Okay. Okay. So, and staying up to date is obviously an important factor because these things are changing. Again, I keep talking about Moore's law, where every technology exponentially grows in every 18 months. And I don't know if obviously medicine has been going through that, but I think now, necessity is the mother of all innovation, and doctors are needing to do that because there's so much money on the line, and there's so much liabilities on the line that if they're not up to date on that part, you had a thought, Wafaa. Sorry, we cut you off.
No, it's okay. The electronic health record or medical record has really been where most of us have had to get comfortable. That is the thing that now when I do my notes, I put the diagnosis, the code is there. So thank goodness for that. But that's probably as tech savvy as you're going to get most physicians, okay? But it has been our saving grace. I agree with you 100%, Khaled, on what you said. It is really sad because we do not have that training. And actually our billing is based on it. So if you bill higher codes, you get better money. So all these things no one ever tells you until all of a sudden you're going, oh, Medicare wants me to bill like this in order for my reimbursement. So this is not a medical, normally I don't have to worry about it, but I just want to take care of people and not be concerned about what code I put in, but 100% I agree with you.
Well, let me ask you, because I want to jump to what's been going on with the COVID crisis and then just kind of tee it up for the future proofing concept and discussion. But from that perspective, what kind of technologies are you leveraging now, you as an entrepreneur in your organization, in your company, which you guys can see? And I'll pull up the website as well, so that you guys have a chance to take a look at our website. But what kind of technologies are you leveraging now for that purpose?
Personally, I can tell you that I am currently using doxy.me for my televisits. The doctors had to quickly find websites and televisit websites that we could use that would work. There's Zoom. Doximity. So the physicians we've all been sharing with each other what's been working the best. So that's been a big thing. The other big thing for me personally has been that I use a patient portal. I have a patient portal that's part of my electronic medical record called Athena Health. And my patients communicate with me, asking questions and things. And never has it been so important as it is right now. I mean, this is like the moment where technology and medicine has never been this important. And obviously we're in high demand during a pandemic. So ironically, this crisis has allowed us, even with remote distant access. I was taking care of some people in Colorado who couldn't get a hold of a physician during the pandemic. So it's given us an ability to really provide care that a lot of physicians we had a boundary, it was a barrier. I didn't want to do telemedicine, and now we've been launched into it. And there are some physicians that will never go back, I think, to being traditional. That's
fascinating. Khaled, do you have any inputs? I know, and again, I'm keeping you from going into legacy and what it's all about, but maybe from that perspective, anything on the telemedicine front or anything like that?
Yeah.
I know
I will just add that we had to adapt very quickly as well, even on the entrepreneurship side. We set up telehealth almost right away, and obviously there's a lot of legal and regulatory challenges associated with doing that. But we had a lot of patients who were not able to see a fertility doctor, could not go speak to an expert, and so but they're still looking for expert insight, and so we started connecting our patients to reproductive endocrinologists and urologists to basically talk through the process of trying to conceive. We had to do that very quickly, and we're lucky to be a smaller company, so we're unencumbered by bureaucracy. But it's not a trivial thing to do, and it's been fascinating to me to see how quickly the world has had to adapt to telehealth. I mean, we work with some doctors who are in their 60s and 70s, and let me tell you, they have never used Zoom before. This is a massive fundamental change in the way the industry is working. And even one more thing that I'll mention is that CMS, the Center for Medicare and Medicaid Services, has removed a lot of the restrictions around licenses. So previously, to do telehealth in Colorado, you needed to be licensed in Colorado. Whereas now, I think it's in 40 of the 50 states, you can be practicing and supporting patients in any of those states from any of those states, which is a fundamental shift, because previously you needed to be licensed in every single state.
I saw that.
Doing telemedicine, which is ridiculous, right? The whole point of telemedicine is you're doing it from home. It doesn't matter what state you're in. But the fact that that rule has been loosened for now is huge.
Excellent. Thank you. Well, let me, Khaled keeps talking about this like seismic shift that's been happening. And obviously the seismic shift's been happening because of the COVID crisis. I know, Wafaa, you've been on the front line with that. Now, I know it's nowhere near the heroes we have across America, especially New York and so forth. But it is, your work has been very preemptive, and you've also been focused on trying to help patients with that and taking up a lot of your own personal time to be able to support and help those who are potential COVID asymptomatic or symptomatic patients. Maybe tell us a little bit about that experience. What's been the biggest challenge? And tell me a little bit about that one story that you said to me about the elderly folks home that you went to and you did some tests there, because I feel that's incredibly fascinating information.
Yeah. So probably mid-March was when most physicians and practitioners realized we had obviously a pandemic, not only a pandemic, but how do we see people safely in our offices? And that was when everybody went, for the most part, everybody went telemedicine, or they stopped seeing people altogether. At that juncture, we realized we didn't have the PPE. So the biggest thing was acquiring PPE, where technology actually had a huge hand. I mean, even Hamada was helping me and linking me with people who were online from all over the world. And we were literally asking for donations in order to do a drive-through testing, because testing was the second large challenge. We couldn't test.
This is amazing.
There was nowhere to test. We'd have to either send them to the ER. We didn't want to emergency room. Oh, that's me there in the white suit. But
yeah, you can see
the
from
bottom
there.
line is we had to acquire the PPE.
Right, exactly. Sorry, go ahead.
It's fine. She was wearing white, but it's before Labor Day.
No. What were you going to say?
No, I'm just saying. I just wanted to quickly give a background of where this image. I mean, you would think you got a nuclear fallout site, but it is where it's. Tell us a little bit about where this photo is.
So let me tell you about that. So fast forwarding, once we had to literally just acquire as much as we could, and our community needed help. And so myself, my team, and a few other doctors, we started doing a drive-through. But this particular picture is actually at an assisted living facility. We found out that the nursing homes and the assisted living facilities were having outbreaks because they have communal areas, and everybody was scared to test them. The people inside were scared, no one would go there. So we took ourselves there, and this particular place, without saying where it was exactly, already had positive patients. So we knew we were going into a situation where people will have COVID. So this is why we're dressed very well. And I tested 52 people, and out of those 52, over half had COVID, were COVID positive. So the good news is that most of them were asymptomatic. I think all of them were asymptomatic, and they were all over the age of 65. So there's a lot about COVID that we're learning, but that's kind of that in a nutshell, that picture.
So again, one of the biggest challenges, I know we're running really hard on time with you, because I know you have to jump off and do a telecall. But maybe just give me a quick, like one of the main challenges you faced, and then one kind of takeaway for just a parting thought for our upcoming medical students and those in the medical field to kind of, again, stay relevant, stay adaptable and so forth, especially given this crisis and what's bound to happen going forward.
I think as a physician, in order to stay relevant at this stage, you have to have a website, even if it's not robust. Hamada, I know mine's not great. You really need to be on social media. I have a following of patients. You have to be careful with HIPAA compliance, but you can do it. And I think that would really bring in a lot of attention to your practice if you want to be an entrepreneur. But first, get your medical degree, try to get some business background, coding and billing, and I think you'd be amazing.
Okay. And one of the biggest challenges that you have in parting thoughts for even people who are listening to this, who are potentially going to be facing even more challenges with the COVID crisis from a medical perspective.
Touched on the most important thing, which is how disjointed medicine is, we need to find a platform where we can all connect and we can get that continuity of care with our patients, because right now, every practice has a different EMR, every hospital has a different EMR. We need to all be more connected electronically and technologically. That's probably the biggest challenge that we are in right now. And that's where I'll leave it.
Okay, well, thank you so much for being with us, Wafaa. Best of luck to you. We will always support you, anything you need from our end. And thank you for being here on the front line. You're awesome.
Bye, Wafaa.
It was great. It was great being here. Bye, guys. Nice.
Oh, there she goes. That teases off very well for you, Khaled, because I think what's happening, and I think what we've discovered, I know this is something that the administration has been a huge proponent on, and obviously I'm not a massive supporter of the administration, but I think one thing that they had to do was really rely on the private sector, entrepreneurs who are more adaptable, more nimble, who can easily amass the resources, the technology to make a dent in this field, especially medicine, and trying to fix the problems that Wafaa mentioned a lot of in terms of connectability and so forth. So maybe tell us a little bit, and then that obviously tees up the kind of work you're doing. Now, your work you're doing, it wasn't spawned, the genesis of it wasn't a crisis, but it is a crisis in and of itself that you felt needed to be addressed as a man who now is in full stride into his 30s. Thank God, finally.
Yeah, I'm still 31.
31. Finally. So tell us a little bit about how you went from what's the genesis of Legacy, how that kind of came about after the World Economic Forum.
Sure. And it was I think so important to have Dr. Wafaa here, because really her experience is kind of the exact opposite in a very complementary way to what I was doing. And I think it's fascinating to hear the business perspective when you're working in healthcare as opposed to the healthcare perspective when you're working in business. So I'll talk a little bit about Legacy. So, believe it or not, I did not grow up dreaming that I would be starting a male fertility company. This was not my childhood dream. I actually wanted to be a soccer player. So obviously went in a bit of a different direction. The thing is, I think there are times in your life where when you see something so fundamentally changing that the rest of the world has not seen, it creates this feeling of necessity around acting. Particularly when you think that you've seen something that no one else has seen or that hasn't been particularly public knowledge. And I think this is where entrepreneurship thrives. So, I'll break it down. So there's entrepreneurship by necessity. I think there's a lot of companies coming out of the COVID-19 crisis right now, particularly around telehealth, at-home services, that have really been born out of an immediate crisis. And then there are companies that are seeing crises that are going to happen and trying to act early in order to help avert them. And I would say Legacy definitely falls into the second category. So, some of the fascinating facts around male fertility that a lot of people don't know is that male fertility has declined by 50% over the last 40 years. So that means that the average man is about half as fertile as his father or grandfather. And it's obviously not something that men talk about very often among each other, but it is something that is affecting couples' abilities to have kids. When you look at demographic trends in the US and the rest of the world, you're seeing, median age is going up. Couples are meeting later. They're getting married later. They're trying to conceive later. The average age of a mother and her first child has, for the first time, has shifted to now being the 31 to 35 age range, which is a huge and fundamental shift in the way that couples are thinking about family planning. Where previously it was kind of the nuclear family, a mom and a dad and 2.5 kids. You now have much more diverse families. There's much more acceptance around different types of families, and within that is kind of deciding when and how you want to have a family. So there's been so much attention paid on the female fertility side of things, and there was no one addressing the male fertility side of things. In part because it's not a very sexy topic to be working in. It's not something that a lot of guys are excited to get up in the morning and talk about. But I think that's actually what makes the opportunity so compelling.
Because you found that it was more of a taboo project or process. And like you said, there was a lot more emphasis on female fertility, almost as the fall guy for any kind of inconception. Typically, the question starts with the woman, maybe she's infertile, versus the man who could be assisting in that. I remember when you approached me with the idea, I think about 2.5, 3 years ago.
Yeah.
One of the things that you told me that really stuck with me, that I keep telling people whenever I mention your work and they think, oh, well, that's not a major health crisis, is to say that as male sperm over time does break down. and can lead to autism.
Yeah.
Which I thought was not just fascinating, but startling. Tell us a little bit more about the different things that could happen with a man when he doesn't think about that kind of stuff.
Sure, it's a very scary thing, and we have to be very careful as a company not to be fear mongering, right? Because so what happens is, as you are older as a father, sperm collects DNA fragmentation, different types of mutations that occur in the sperm, approximately 1 every 8 months. So what that means is, over a longer period of time, by the time you're in your late 30s and 40s, you're seeing these genetic mutations begin to come out through the sperm. And so what that means is, if you are having a child, you have an increased risk of congenital conditions like autism. But I don't want to get too much into the technicals. You know, how I want to make sure I'm also answering questions that are the most relevant for folks who are listening. You know, what do they most want to learn about him? I'm guessing it's not just the sperm mutations. You know, what are the questions that I can be helping to answer for the audience?
Yeah, I think taking a step back, I think we've set the scene of why this is an important topic and why people should stand up and listen. You obviously have a very robust website that has a lot of content for the That's
a good looking website.
Well, there you go. And basically, you've kind of set it up. There's a ton of information here, resources for folks to kind of go to and get a better sense of all the different discussions and major points that they should be thinking about. Maybe tell us a little bit about how you really focused the company, which has, at least if you just kind of speak about it in more general terms, doesn't seem to be that tech required, right? Mm-hmm. But it is. So maybe tell us a little bit about the technology that you've had to really incorporate into this process. Yeah. Tell us about that.
That's a great question. And I think this comes down to this, the difference between a company that is a tech company and a company that is a tech-enabled company. Mm-hmm. And, you know, a pure tech company is, you know, a company that is offering a purely technical service online. And the definition that usually is where the marginal cost of distribution is zero. You know, you've created a piece of software to sell it to more people, costs you effectively nothing because you've already done all of the technical work. So any of the major websites that we go to are all really tech companies. We are tech enabled in the sense that the core product that we offer, which is sperm testing, sperm freezing, these are all fundamentally healthcare services, right? There is still a physical product. There is a physical service being performed. What we've done, and what I think is so fascinating, is that this industry is, my God, still living in the 1950s and the 1960s. You are talking about, you know, sperm banks, for example, that have existed for decades with zero innovation. And so what we are doing is almost the very classic Clay Christensen definition of disruptive innovation, right? We are taking a completely new approach to how men are thinking about the topic. We are taking a completely new approach to how men actually go through the product and the service. And the biggest change we started with is, instead of actually going to a clinic to go and get your, you know, sample tested, we actually send you a kit to your home. You can actually produce, you know, what we call produce the sample at home. We pick it up, we courier ship it, we get it to one of our clinics, and we test it. So what that means is we fundamentally change what the process looks like for a man, whereas before there's kind of this shame and awkwardness and discomfort associated with going to a clinic and producing a sample there and getting it tested. To really, you know, I hate the term empowerment. I think it's very patronizing, but at least putting control in men's hands, right? It's you can do it from home. And what we've done is, so, you know, you can even see the report on the screen right now. We even show the results in a very simple, easy to understand way. Right now, if you go to a clinic, it's kind of like getting a blood test done, you know, where you just get a long list of numbers. You have no idea what anything means, right? You see that you're out of the normal range for 1 or 2. You obviously freak out. Does it mean you're dying? Who knows? You know, so what we've done is we've totally recreated the format. It's much more interactive. It's much more visual. You get graphics and explanations of every step along the way. You know, we pair that. So everyone who goes through the process answers about 100 questions, how they're eating, how they're exercising, all of that good stuff. Based on that, we've built out an algorithm that generates personalized recommendations for them, right? So your BMI is this today. If you were able to bring it down to, you know, this amount, we think it's going to boost your fertility in the following ways. If you introduce, you know, this into your diet, or if you change your exercise habits in this way, here's how it will actually boost your fertility. And that's something that a traditional fertility clinic can't do. They don't have the data, they don't have the algorithms, they don't have the capabilities, frankly, because everyone's about 100 years old working at these places. And even introducing something like telehealth, right? That's a real competitive advantage for us. Again, because we're nimble, we're small, we can respond very quickly. This is not something that a traditional sperm bank or a traditional fertility clinic can just incorporate right off the bat. So these are all ways in which the core product, which is not that different from what you would get at a traditional clinic, is completely tech-enabled, much easier, much faster. And because we operate at volume, right, we see hundreds of people per month, not tens. We're also able to do things at volume, and we're able to get much better pricing as a result. So you end up paying a third or half of what you would pay at a traditional clinic because we operate at scale.
Yeah, I mean, I went through the process with you, at least to get the testing. As I said, it was important for me because what you did, you also provided a step-by-step of simple things you can do, and then more involved things that you can do to be able to help with the process of male fertility and so forth, which again is an issue that any man will face at any point. I mean, I think in this day and age, in terms of what you eat, the air you breathe, the stresses that you go underneath, that you endure, everything else that are happening around you, all of that can and will impact your fertility, which is why it's mission critical, as you say here, to be part of the conversation and not to let it
go. Something that a lot of men and even women don't realize is that I think there's a lot of sexism actually around the topic of fertility. There's always this assumption that fertility is kind of a women's issue, and we have shown, and the science has shown, that actually men are really equally likely to cause difficulties in conceiving if you're a couple, as a woman is, again, assuming a heterosexual couple. But what that means is that men should be taking a more active role in thinking about fertility, getting it tested, and thinking about how to improve their fertility as well.
Yeah, and I know we'll cover this, that you offer different price points to just do the basic testing all the way through as what you have here in terms of the cryo freezing or the cryo storage and so forth as part of the tech-enabled aspect of your business, and B, providing that long-term necessity for people who want to be able to provide and conceive late into their 40s, 50s, even beyond. You have a doctor here. Again, we talked about the necessity of having doctors as part of the knowledge, the resources, and the credibility to your company. What kind of doctors are you affiliated with?
Yeah, this is actually, you're touching on something extremely important, which is, there's a lot of hesitation in the healthcare world around what are perceived to be tech entrepreneurs coming in, trying to make a quick buck. And so there's always this tension between, when you are disrupting an incumbent, you are doing so in part because there's a market opportunity, but also because you want to be offering a better healthcare product or service. Right. But there's a lot of skepticism around, folks who are just out to make a company, to start a company, to make a quick buck. And it's extremely important, at least to me, when thinking through how to build out my team, how to bring on advisors, that everyone has this credibility in, they have healthcare experience, they have fertility experience, they've worked at clinics, we have doctors. And so this was actually a big part of my thinking from very early on. So Paul Turek, who's based on the West Coast, is one of the leading experts on male fertility. He's a phenomenal advisor to us, and we actually we flew over back when we were still allowed to fly, and go to other cities. We filmed a video with him and also with Dr. Alia Yaqub. We actually filmed videos with them where they're talking a little bit more about our product, why it's important, why a man or a woman in a couple should be thinking about bringing it on. And you can see we actually have 9 advisors, of whom almost all are either international experts on fertility, are fertility specialists. And you need this kind of credibility, especially, at the end of the day, I have healthcare experience. I've studied healthcare policy and public policy, but I'm not a doctor. I'm not a fertility specialist. And so bringing on those specialists is extremely important for any business in healthcare. And it's interesting because I think if you're a doctor, you have the opposite challenge, which is you need to bring on folks who have business savvy onto your team. I see you smiling, Hamad.
I do.
Because of the photo with my mom. It's a cute photo.
As a sidebar for the audience, Khaled went to the Harvard Kennedy School. His brother went to Harvard as well to do his PhD, I believe, and now will be back at Harvard. And his mother actually went to Harvard as well and pursued the same program that I did a year later, which unfortunately I wasn't with her in the same class because she's an incredible.
Then she got better grades than you did.
And she definitely. In any event, so I think that's a very, very important aspect, which is the concept of how to build a practice that is its backbone. Its very backbone is not, as you said, to make a quick buck, but it really is about trying to get to the nuts and bolts of a very, very fundamental question, and using the experts in the field, corralling them together for their resources, as I said, for the credibility, and being able to help you forward think and forward lean in terms of where legacy can go. Let me take a step back, because as much as I want to just keep talking about legacy, and hopefully we'll have another opportunity to do so, I want to go back to you. You went to the Harvard Kennedy School. What learnings at the Kennedy School did you take away that you were able to apply and leverage this career path? And then I want to kind of shift it over to our last segment, which is really about the future proofing.
Cool. So HKS was an amazing experience. I'll start with that. I think it's not just about being at the Kennedy School, although that certainly helps. What's amazing about being at Harvard in general is that they teach you the mentality that you can literally do anything. So I had gone to McGill for my undergrad in Montreal. It's an amazing school, one of the best in Canada, well-respected internationally, but the exposure that you have there is not quite the same as you do at a university like Harvard, where your colleagues or folks who have gone through the same program or the same fellowship or the same experience that you have gone on to become prime ministers and presidents and
right.
Major Fortune 500 CEOs, and just that feeling of like, hey, looking around, that guy over there, that girl over there, they could be the next prime minister of the country, is kind of this intoxicating feeling that just makes you feel like if they can do it, we're in the same program, then I can do it too. And I think that mentality that Harvard teaches you is phenomenal. The professors are also in the same way. They have taught all of those students. And when a professor tells you that they see in you what they've seen in other candidates or other students who've gone on to do amazing things, that's a vote of confidence that goes a very long way. And so I think that's probably the most important thing about my experience. There were a number of classes, and this is one of those things that I think is especially when it comes to entrepreneurship, you are growing so quickly. You as a person professionally are forced to grow and evolve and become a leader and manager in ways that you would never have expected. The challenge of that is always that by the time you know that you need to do something, it's almost too late, right? By the time you need to know that you need to become a good manager, you have maybe a month to become a good manager. So it's almost like you have to have developed those skills in advance. That's what HKS is amazing at doing. They teach you negotiation, they teach you leadership, they teach you communication. They teach you all of these soft skills that don't feel as critical at the time, but actually are foundational to becoming a good leader at a company, be it your company or working at another company in the future. And that's what I think is so important about getting these kinds of experiences.
So let's shift it over to our last part of the show, which is really about the future proofing and the healthcare aspect. Now, some of the stuff Wafaa was able to provide us with anecdotal information that I think can also feed into this concept of the future proofing. But again, for the audience to remember, future proofing in and of itself was a concept that was really tech focused. It was more on the computer side, software side, and so forth. And it's the idea of how can you think and lean in the future to preempt anything that could actually impact your ability to succeed, especially in the professional way. That is how I've interpreted, and other people have interpreted, the concept of future proofing, not just as a technology where you have to think in advance of how that technology won't become archaic or redundant, or the term is I can't even remember the term, but where you basically something becomes I guess not. Yeah, exactly. And so in this case, it's not just about you or the technology, but it's about you. It's your career, it's your education. What could you be doing to be thinking in the future? One of the people that I've been reading on, Joseph Owen, who's at Northeastern University, raised the topic and wrote prolifically about robot proofing within the education system, to be able to have digital literacy, to think in the future, to think in advance, and not just to take core basic subjects, but also think about those subject matters that allow you to think in a technologically savvy perspective. So when these things come up, like for example, you, Khaled, I imagine when somebody raises an issue about a tech piece, when you were at Y-Combinator in San Francisco and somebody's talking about a tech perspective, you're not clueless, but you're basically understanding already how that could be incorporated and embedded in a technology-enabled company. Maybe if there's anything on that you want to add.
Definitely. I first of all, I love that you're bringing this up, and I think it's extremely important for the audience to be thinking about how they can be future-proofing their career and their skill set. Thing is, a lot of folks don't realize that diversification, as important as it is in finance, right? If you want to be investing, you should be diversifying your investments. You need to be thinking the same way about yourself, and you need to be diversifying the types of experiences that you have.
Right.
If you've only ever done one thing in your life and you do that really well for 10 years and suddenly the industry shifts, you are caught unawares, you are out of a job, you don't have the ability to rebound or get into, or even, even connect with another network where you can shift jobs. I mean, this is just, it's so easy to fall into what I call it the trap of inertia. You're doing something, you're doing it well enough, and the whole concept of inertia is that an object in motion stays in motion. You're doing something today, you're gonna just keep doing it into the future. And I think that is the single most harmful thing that a person can do, because if you really want to grow in an exponential and quickly compounding way, then you need to be getting diverse skill sets. So I spent a few years working in management consulting, extremely important for efficiency, structure, project management. These were all very tangible skills that I took away from that. Experience at the Harvard Kennedy School taught me a lot about public policy, about public health, about tri-sector leadership, thinking through nonprofit leadership and private sector and public sector. It's a very different skill set with a very different network. And then after that, I worked at the World Economic Forum, again, building on government relations, business relations. This was a different skill set than what I had before. And then going into entrepreneurship, which is again a related but different skill set that I had to learn. What this means now, though, is I'm in a position where I will never be worried about not having a job, never being worried that I'm going to be completely disconnected if the world, if the world's moving too quickly, I'm caught unaware by technology shifts. There's always a public policy network I can tap into, a private sector network that I can tap into, an entrepreneurship sector that I can tap into. And this is the reason so few people do this, is because it's scary and it's hard. I remember in one of my first Kennedy School classes, so there I was, I had studied business, I had worked in business, I knew very little about the world of international relations from an academic sense. And what was the word? It was normative. So there was this word that came up in so many of our classes, and of course, and so is a very normative, was a normative behavior. I had no idea what normative meant. And so I asked my colleagues and they kind of laughed. They're like, who doesn't know the word normative? We all know the word normative because we all studied, political science and international relations in undergrad. And so you have to go through this kind of ignorance and unawareness. I felt the same way when I joined the World Economic Forum. I definitely felt the same way as an entrepreneur. I feel that way literally every day. I have never been less competent in my life than I am today. Right. But these are the experiences that teach you so much more than you will get just staying in the same career. You just have to suck it up and deal with the fear. You have to sometimes take a deep breath and just take the plunge. And this is the kind of thing that will help you see compounding returns. Because over the past decade, I've now had private sector experience, effectively public policy experience, nonprofit experience, and now entrepreneurship experience all over the past 9 years.
And that's exactly right. It's almost hedging your career and hedging your future by proofing it with the ability, as we say there, to be cross-functional, to think in ways of how you can. Because if Khaled understands government and understands fundraising, and understands entrepreneurship and understands people management, you start to think of things in a cross-functional capacity, and it allows you to understand how and which teams work in terms of design thinking to be able to solve a compelling problem. In this case, it's male fertility. Maybe in 10 years, it's another issue that Khaled will be facing from a healthcare perspective. And I think that's what you kind of mentioned in terms of the concept of upskilling, keeping yourself relevant, keeping yourself marketable, and being able to. I think those are really, really key fundamental things. And I know for myself personally, starting off as a history major and a poli-sci minor, and then ending up in a career of law, which is not a huge transition because a lot of people end up doing that, but then going from there into entrepreneurship in an academic setting, then from there jumping into international development and government work, and then from there working in terms of helping companies with digital transformation while always kind of thinking about the legal perspective and doing things that you really are passionate about, like traveling for me, which obviously, as you can see the map behind me, which is like the fourth map I have in my house. Traveling to me is mission critical to my DNA and to how I function and makes me who I am, which gives me that confidence to do more public speaking, to do talks like this. It all fits in. It's kind of like how Steve Jobs said, you have all these dots of different points in your life. You think they're not interconnected, but they are, and they all lead you down a path towards a certain purpose. And I think Khalid's description is exactly that. And to take it a step back in terms of the world of healthcare, I believe a lot of people have been able to attach that. We talk about augmented reality, right? We talk about virtual reality. We talk about artificial intelligence, 3D printing. I know that's been happening a lot with even the ventilators, sensors and tracking within even humans embedded, and so forth. So there's so much tech that's coming into it. And I would say, Khalid, you can correct me if I'm wrong, a lot of the market leaders in healthcare technology are not necessarily doctors themselves,
but big time.
Or kind of jumping in between both worlds to be able to bring that to the world, with the goal of what I'm saying there is accessibility, better accuracy, better scalability, more affordable, because like telehealth is a lot cheaper than coming into the office and so forth. It's cheaper on everybody's perspective. And the connectability, how you can connect people across the world and between professionals, the interprofessional connection that can come from the advances in healthcare.
You're hitting on something I like a lot, which is all of the goals that you listed: accessibility, accuracy, scalability, affordability, connectability. I mean, these are all things that if you're ever thinking about starting your own thing, you need to be thinking, especially in the context of healthcare, which is how can you make your product 10 times better than what exists on the market today? Can you make it 10 times more accessible? Can you make it 10 times more accurate? Can you make it 10 times more affordable? Whatever that might be. But if you're going to be successful setting up your own business, if you are thinking as an entrepreneur, you need to be thinking, how can I create a product that is 10 times better, with goals like these in mind? And you want to talk about future proofing in healthcare. I mean, this is the future of healthcare. This is going to happen whether you're doing it or not. So it's better to get on board and get in for the ride.
So from people that have come and talked to you, I know one of the things that you do is you're not just gung-ho career focused on your company, but you've mentored a lot of people the past 5 to 10 years based on your own path, and people seeing the proof in the pudding in terms of your own actions. What advice do you render to people now, especially those students, and the people that you've come across that want to basically learn from your experience in terms of future-proofing their education en route to their career? We've talked about hedging in terms of your career and trying different paths, but from the education perspective, what would you say would be like the top 3 takeaways of how to really future-proof your education? And I don't just mean from a Kennedy School perspective. I don't want folks to look at this and say, well, they're just talking about from a Harvard perspective. But anybody who's pursuing any education, how would you do that, especially with healthcare?
So I have a theory that I call the lateral jump. I think a lot about a guy that I met in Toronto who was a Pakistani guy, had gone to a no-name school in Pakistan, but used that to get accepted to a small liberal arts college in the US, used that to get accepted to a decent management consulting firm, used that to get accepted to a pretty good MBA program, and then used that to get offers from McKinsey and BCG. And then I think ended up joining McKinsey, if I remember correctly. What I think was so powerful about that was that he was willing to make these lateral jumps, right? It was both geographic jumps as well as industry jumps, but always his goal was to climb, to move up a step. And I think that's important, because if you are limiting yourself to only just the one path that you are on, and you are just looking at the rungs of the ladder that are immediately above you, then you are missing out on all these amazing opportunities to take lateral jumps that will eventually get you higher faster than if you were just to try to go straight up. That's the big one. And the second is just, you should be having, and this is what I tell everyone that I mentor, which is you should be having at least 2 major fundamental life crises every year. I have one probably once a month, where you are really stepping back and just saying, what the hell am I doing with my life? Should I keep doing this? Does this make sense? Or is it time for me to make a change? And more often than not, the answer will be, yeah, you know what I'm doing now is fine. I'm going to keep doing it. But it is that kind of thinking that gets you to defeat the power of inertia, which is keeping you where you are, how you are, because it's so easy to do that. You need to have these life crises, and if you're not having these life crises, you should be having a life crisis about why you're not having these life crises.
And I would know that because Khalid has often consulted me when he's had these life crises, including.
That keeps me sane and keeps me on track,
and vice versa.
The right track.
And I remember that because when you were working in the World Economic Forum in Switzerland in a very cush job, and I would see you out there in Switzerland, it was a pretty big leap of faith. And a lot of people kind of look back. You were definitely a starlet within the World Economic Forum.
I still remember my boss and I sat down, and he actually sat down to offer me a promotion to be basically chief of staff to the president of the World Economic Forum. It was a very big jump, good salary, good all this stuff. And I told him, I'm like, it's funny that you're offering this and I'm going to have to decline because I'm actually leaving to start a fertility company. And just the look on his face was priceless. So it was a very cushy job. It was a very comfortable job. It didn't feel like the right continued step for me. It was inertia that was keeping me there.
And I think that's the point. It's the life crisis, but it's the inertia. It's both. One feeds into the other. If sometimes it's not even a crisis that causes the inertia, it's the inertia that you should basically try to nip at the bud through the life crisis that could potentially arise. And so you're already forward thinking. What's the third takeaway?
Yeah. Third takeaway is just you got to keep your eyes open. You got to keep your eyes open. Take classes in other faculties. Make friends with people outside of your social circle. Whenever you get an email, read the whole damn thing, because always the good stuff, the juicy stuff, the best stuff is always hidden in the footnotes. And if you are the person reading the footnotes and nobody else is, then you are going to get these opportunities. You don't know how many times I've either got an award or gotten grant money or found a job opportunity just because it was buried in paragraph 25 of some godforsaken email that nobody else reads, but I read them. And this is how I was exposed to all these opportunities. And I think that as long as you are pushing yourself to be outside of the traditional networks that you would otherwise be in, you are getting exposure to these different ideas. So make friends outside of your program. Visit your friends in other geographies. You need to always be introducing yourself to new ideas, because it is these new ideas that lead to the life crises that lead to you overcoming the inertia that is keeping you where you are today.
That's perfect. Thank you so much, Khaled. I think that's very, very important.
Thanks for having me.
A very fundamental discussion on the healthcare perspective, looking at it from two completely different angles. Next week, we're going to shift over and we're going to focus on the final facet and our final part of the series of future-proofing your education and career by looking at the many faces of law and the future of advocacy, which is very close to home, given that's the trajectory that I've taken. We're going to be featuring some awesome speakers next week. So please tune into that. It's going to also be on the LinkedIn Live that you're seeing now, also on our website for Right Track Admissions website, where we'll be putting it live, and then also recording it and putting it up on YouTube so you can see it there under our YouTube channel of Right Track Admissions LLC. But again, in the meantime, next week, tune in the same exact time, 10 a.m. in California, 1 p.m. in New York, and 6 p.m. in London time for a fascinating discussion on the many faces of law and the future of advocacy, especially given what's been going on now. Without further ado, I do want to thank Khaled. Obviously, Wafaa has signed off, but I want to thank you, Khaled. Thank you so much for taking the time. I know you're extremely busy doing some amazing, amazing stuff. Anybody wants to check out his website, it's givelegacy.com. We'll be putting that in the show notes at the end. Thank you for your time, Khaled.
Of course. Hamada, what can people do to stay connected with Right Track?
You'll see it there. It's the videos. We're coming up to the new admission season. So anybody who needs the guidance and the help, and as you can imagine, especially now with trying to navigate what's been going on with the crisis, we know that Harvard's not going to be open in the fall. Stanford's not going to be open in the fall. The whole California State University is not going to be open in the fall. There's a ton of things happening from a financial perspective and an academic perspective they should be aware of. So definitely hit us up. You can hit us up on a multitude of different angles, obviously righttrackadmissions.com, and then obviously on my own LinkedIn and the LinkedIn of Right Track Admissions.
Last thing I'll mention very quickly is part of the reason I was so excited to do this is that Hamada has helped 3 of my close friends get into Harvard and Stanford. So if you haven't already talked to him about Right Track, you should, because he's good at it.
Right back at you, Khaled. Thank you so much for taking the time. I wish you all the very, very best with the organization. And stay safe, stay sane. And
next time you see me, I will look a lot more respectable than I do today.
I'm liking this look. I think I'm gonna have to cut my hair again, but maybe we should keep growing yours. I like the look.
Nice. Okay.
Take care. Thanks, everyone.